Welcome, everyone. Thank you for joining us for this webinar. Today, we are going to talk about autonomous solutions and how they help to enhance productivity and safety in the healthcare industry. We're also going to talk why hospitals apply robotic automation in 2023. And my name is Maxim, and I'm a BD manager at Gausium and a host of this webinar. This webinar is offered to you by Gausium, the world-leading provider of autonomous cleaning and service robots. Gausium was founded by Edward Chen in 2013 out of passion for autonomous driving. Today, Gausium has become a leading company of AI-powered autonomous cleaning and service robots with more than 4,000 successful deployments in 50 countries and regions. Our speakers today are Hector Spalat, who is an expert in the health care cleaning operations and a head of key accounts at Gausium. Also, Hector has over 25 years of experience in both environmental service and manufacturing aspects of healthcare cleaning. For the past 10 years, Hector has worked directly with both national accounts and standalone IDNs, primarily focusing on infection prevention. And our second speaker today is Peter Questro. Peter Questro is a global BD development director at Gausium with over 34 years of experience in cleaning and facility management industry. And for the past 7 years, Peter is specializing in cleaning and service robotics. Our webinar will have two parts, and during the first part, we're going to talk about current challenges in the healthcare industry that we face in 2023. And during the second part, we will talk about the role of robotic automation in healthcare industry. And let's start this webinar with the first part, where we're going to talk about current challenges in the healthcare industry. With that, I pass the microphone to Hector.
Good day, everyone. Thank you for joining. Healthcare industry in 2023. What are the things we're seeing? Labor shortage. We can't say enough about that. Facilities across the U.S. are averaging an estimated 19.6 staffing shortage, according to surveys conducted in December of 2022. Shortage of skilled laborers. All those individuals who were trained for proper discharges, cleaning, floor techs are leaving, and now we're having to retrain and bring in new staff. Patient areas are the priority. This leads our public areas and corridors to go unintended. High employee turnover. Individuals are transitioning out of healthcare into other sectors and other fields outside of healthcare for overall safety concerns. Higher cleaning demands in healthcare facilities. Higher cleaning frequencies are necessary to reduce patient exposure to bacteria, fungi, viruses, and other less common pathogens that cause HAIs, hospital-associated infections. Healthcare facilities lose millions of dollars annually due to healthcare-acquired infections, making proper cleaning and sanitation crucial to their operation. According to research, 97% of all surveyed hospitals would clean and disinfect high-touch surfaces daily. 93 would disinfect restroom surfaces once a day, just to ensure they're taking the proper steps to keep their patients safe and lower their exposure to help reduce the risk of HAIs.
Indeed, it does. Hello, everybody. My name is Peter. Welcome. Nice to meet you here. So I will take over the prevent of cross-contamination. Of course, this is a very important subject in all hospitals. Separating cleaning on all sectors, of course, so that they don't mix up. And beside that, the risk of COVID mutations and new breakouts is still very real today. After COVID status related to cleaning in healthcare and the threats of recurrence and reinfection. I always say, you don't say now we know how to put out a fire, so let's set the house on fire again. We don't know how fire resistant we are, so it's better to avoid another fire, of course.
Increasing cleaning costs, something we see on a regular basis. Generally, hospital cleaning is about 25 to 50% more expensive than regular commercial cleaning due to the attention to detail and disinfecting requirements. Research shows facilities in the US average cleaning cost is roughly $1.89 a square foot, which is the second highest of all on the list. The average size of a US facility is over 243 square feet, requiring a workforce of around 52 FTEs. This means staff members need to clean an estimated 4,600 square feet on average per shift. Between the fall of 2020 and the fall of 2022, the cost of raw materials for healthcare supplies in the US has increased at an excess of 30%. Hospital labor costs in the US rose more than 1/3 from pre-pandemic levels by March of 2022. According to a special workforce edition of Kaufman Hall's report, for environmental services, the annual salary in 2019 was $31,500, compared to a national average of $43,200 in December of 2022.
Yes, and also in Europe, the trend in cost increase on labor rates are between 3.7 to 10% on average. Plus, less time is spent on cleaning and on administrative tasks, what actually should be done, because the lack of time, the lack of people. So this still goes on.
The well-being of the workforce is under threat. Throughout the pandemic, an overwhelming workload of healthcare workers have led to widespread stress and exhaustion. According to surveys conducted by Statistics Canada, 86.5% of healthcare workers felt increased stress during the pandemic. Compared to other healthcare occupations, nurses were most likely to feel the stress of having to increase workloads due to their role providing hands-on care to acute care settings. As we know, there are groups that mostly like to they are the group that mostly likes to report that they are moving or leaving somewhere else, as they like to let everyone know what their thoughts are. But there are a lot of people who are unhappy and will not say anything and move forward. As we look into the future, healthcare workers will be caring for an aging population and a greater number of chronic health issues. The demand for healthcare workers will only continue to grow globally, despite the exhaustion they've been experiencing. To keep a healthy, robust workforce, healthcare providers should take both short-term and long-term steps to reduce burnout, increase job satisfaction, and create a positive work environment.
All right, thank you, Hector. Thank you, Peter, for sharing with us the picture on the healthcare cleaning. And now we move to our second part, where we're going to talk why should hospitals supply robotic automation. And I'm passing the microphone back to Hector.
Better cleaning care for patients with robotic automation. Cleaning is caring. In a healthcare setting, cleaning is especially crucial. Hospital and other healthcare facilities are at high-risk environments for patients with compromised immune systems that are being treated. Regular and thorough cleaning and disinfection will help prevent the spread of infection and reduce the exposure of harmful pathogens. By adopting robotic floor care, healthcare facilities can provide a safer, more supportive environment for their patients and healthcare workers. Environmental staff can focus on disinfection while the automated scrubbers safely clean their floors daily.
And another common issue for hospitals is the efficient delivery of meals and other medical supplies, particularly during the pandemic when reducing person-to-person contact was a priority to prevent the spread of illnesses. The adoption of robotics can help relieve the burden on nurses and other hospital staff. Using delivery robots help reduce the risk of diseases transmission and minimize the need for health workers to move around the facility searching for medical supplies. Artificial intelligence and robotic devices have become more common in healthcare facilities. And this trend, increased during the COVID-19 pandemic, leading to a greater emphasis on sanitation and social distancing. Autonomous robots such as cleaning and disinfection robots have become an increasingly common solution for higher hygiene in healthcare. So what about the benefits of automation for your cleaning and delivery today? Well, first of all, safer hospital environments with robotic floor cleaners is what you get, of course. With robotic floor cleaners as a co-assistant, cleaning is done consistently, which prevents the spread of bacteria and viruses. Robots can also work around the clock, which means that cleaning can be done overnight or during off hours, which also helps you to minimize disruptions to hospital operations, and it will boost the overall efficiency. While robots are taking over most of the floor cleaning, human staff can take advantage of the redeemed time to clean high-touch areas more frequently, such as door handles and handrails, and this creates, of course, a highly efficient and effective sanitation process that will ultimately lead to fewer infections and illnesses among patients and the staff. So, how to improve precision and productivity with artificial intelligence-powered autonomous solutions? Well, robotic floor cleaners carry advanced sensors and autonomous navigation systems that allow them to clean every inch of a floor in a hospital, precise and very efficient. So these robots use state-of-the-art algorithms to map out the facility and to create an effective and efficient cleaning path that covers all areas. By automation, the cleaning process, robotic floor cleaners can ensure that cleaning is performed consistently and accurately and improve overall cleaning results. Like you see on the sheet on the right, you see in a traditional way of cleaning by manual, you take about 300 hours of manual operation and about 30 hours to upkeep your gear. If you change this and you compare this with a robot like the Scrubber 50 you see here down below, it will take about 130 hours autonomous operation and only 2 hours upkeep. So here you can see very quickly that you can save a lot of time and you have time for doing other things.
How can we enhance employee engagement? It's always key. How do we keep them happy, involved, and satisfied in what they're doing daily? Robotic automation can take a repetitive mandate task, freeing up employees to focus on meaningful and engaging work. At the same time, when hospitals implement autonomous cleaning, employees have an opportunity to learn new skills that can be used to support the technology. This can include setting tasks, maintenance, and troubleshooting. By providing opportunities for skill development, a company can show employees that they're invested in their growth and development within the organization. Autonomous robots can act as assistants to employees, helping them complete their tasks more efficiently. This will help employees feel more accomplished, engaged in their work. Overall, automated cleaning can help engage workforce by providing new opportunities for learning and growth, improving job satisfaction by making them more meaningful and impactful. At the end of the day, an engaged employee is a better employee. It'll help reduce your turnover, it'll keep them happy, and again, give them an opportunity to develop and learn new things.
Okay, and now let's talk about dollars. So how to calculate return on investment for healthcare floor cleaning? Well, first, I will show you an indication in return on investment on a Gausium Ventus 4-in-1 cleaning robot as an example. And again, this is just an example, of course. Every situation is a different project, we always say. So to calculate the return on investment, you need to know the following facts, the following parameters. First of all, you need to know the cleaning hours, or the square feet or the square meters, depending on which side of the world you are, or you're cleaning daily at this moment, so currently. And of course, you need to know the total cost of a healthcare cleaner, including taxes and benefits. As you can see here on this little picture on the right, you see that in this case, and again, this is just an example, this is somewhere in LA, the wage of a cleaner is about $20 an hour. But the real cost of a cleaner is, of course, more than that. If you calculate all the taxes and benefits that a cleaner will get, then the sum is about $25 roughly. But again, this can variate, of course. There will be places where this is lower, and there will be also lots of places where this is much higher, depending on where you are. So going back to the list, what you need is, of course, also the investment cost for a Fantas 4-in-1 robot. And how many days a year and how many times a day you want to clean. Because with the robots, you can clean very easily twice or even 3 times a day for the same cost. And how are you cleaning today? Are you dust mopping? Are you vacuuming? Or both? Or separated? Or are you scrubbing and drying with a walk-behind machine? Or are you sitting on a rider machine? All those parameters make a difference when you calculate the return on investment. But I will give you a nice example. So let's see how to save about roughly $160,000 in 5 years on a healthcare floor cleaning with this compact robot you see here on the screen on the left. And to explain you a little bit and not go into too much detail on the right, because as I said, every case is his own specific unique case. Everything that you see here is yellow, and that's a lot. You have to fill in on the spot. So when you're having to calculate your own building, you calculate it this way. So of course, the ingredients I just mentioned are all here. And if you compare, this Fantas, this is the name of this little robot here, you compare it with a walk-behind scrubber dryer traditionally, or with a manual vacuum cleaning traditionally. You do this every day for, let's say, 1,500 square meters, which equals about 16,000 square feet. Then you will get a sum of $38,000 roughly as a cost a year, while you are saving actually $32,000, the green area here, $32,000 a year. If you do this times 5, times 5 the financial and economic life of a robot at least, because most of the time they will last longer, of course, but you write them off in the books in 5 years, you will save roughly about $160,000, which is of course a very nice figure and makes it very interesting. And to make it a little bit more, easier to calculate, this will be roughly about $1,800 a month. Of course, this is just an example. Again, every and each project has to be calculated on its own, and there are experts that want to help you with this, of course. It's just an example, but it's a nice thing to predict what your cost savings could be.
Gain a competitive edge. How can robotics help you get that competitive edge? A clean and well-maintained hospital environment creates a positive impact on the hospital's image. Patients, staffs, visitors expect a clean and hygienic environment with effective services. And robotic cleaning and delivery systems can help you ensure that this expectation is met in a safe manner. By implementing cutting-edge robotic application, healthcare facilities can maintain their commitment to innovation and overall excellence, which will separate you from your competitor, who will not be using technology to help their facility stand out in the market. By investing in cutting-edge technology, healthcare organizations can demonstrate their commitment to providing a safe, high quality of care, increasing your cleaning cycles, which can lead to a positive word of mouth and increased patient satisfaction and loyalty. And there's also the financial gain for an organization. Robotics will allow you to enhance your cleaning program, allowing staff to focus on the disinfection, which will help reduce your HAI scores. Robotic delivery in healthcare. Delivery robots limit the need for resources to deliver medical supplies and food and medication. It can be programmed to follow specific routes to reduce the needs for reallocating individuals to support facility needs with current staffing conditions. At the same time, might mitigate the risk of transmitting harmful pathogens between different areas of the hospital. The adoption of robotics can help relieve the burden on nurses and other hospital staff. Using a delivery robot reduces the risk of disease transmission and minimizes the needs for healthcare workers to move around the facility, delivering medical and cleaning supplies.
And now let's look at the technical aspects.
Into this, I forgot.
Delivery robots. So autonomous delivery in 2023 have a lot to offer on the technical aspects. So today, delivery robots have a very impressive specs, such as load capacity up to 30 kilos, calculation of the most efficient path for deliveries, and trays that are equipped with weight sensors and LED indicator lights that indicate and signal the load status. And of course, the navigation algorithms of the new gen service robotics are based on a fusion of LiDAR and 3D depth cameras, and actually fission slam LiDAR, which provide high level of environmental perception and very smart obstacle avoidance. So beside all the technical aspects, there's also a big impact on the environmental status of this. So how can we minimize the environmental impact of this cleaning? Well, the new generation of autonomous robots calculates the most efficient path in the cleaning operations to cut down energy consumptions and to provide the data for you to objectively measure your environmental strategy. So some of the robots include even an auto spot cleaning mode, delivering remarkable energy efficiency by bringing it up to 400% efficiency improvement. And it will only take about 1/4 of a time as much energy as a regular path planning mode to clean the same area of space you do traditionally. This means the robot can reduce up to 75% energy consumption and carbon emissions. So some models are even adapted with multi-stage water recycling filtration technology that saves as much as 80% of the freshwater usage. So we use the water twice if it's needed. Of course, this is only recommended in public areas. When we talk about the hospital, I would never advise to do the recycling system in the patient's areas. So with autonomous robotic solutions, business owner can create a more inclusive workplace for disabled people. Like service staff that physically disabled will be able to fulfill the service task by remotely controlling the robot via the app. Everything is possible because of the combination of a good environmental concept and technology. So let's wrap it up. Let's resume the things we discussed this evening, or sorry, in Europe it's evening, your place it's only afternoon, sorry. So why cleaning robots should be part of everyday healthcare floor cleaning? Well, first of all, there's to fill in the gap on labor shortage of the aging working and non-working population. And the aging working population is getting smaller and smaller, and the non-working population is getting larger and larger. So we are out of balance. So robots can help in here, can step in here and make our lives a little bit easier and make sure that we're all getting old on a safe way. Secondly, is the increase of the productivity of cleaners. So work more economic and smarter and not harder. There's already enough pressure and enough, hardworking people in healthcare industry. So we should not, have more pressure, but less pressure. Bringing in robots can do this. It's a part of the puzzle, of course. And third point is decreasing the ongoing growth of labor costs for healthcare floor cleaning. Costs are rising, everything gets more expensive, also wages going up, and costs are rising all the time. And the robots can do something about this. So, instead of only focusing on the first 2 points, you can also save some money here. And that's also important for your competitiveness. So enhanced quality finally and consistency of cleaning. So safer buildings with a lower ecological footprint. Well, if I read all this for resume of all the things we can do today with a robot to help the status of your hospital or your elderly home or any other building you have in healthcare, I think it's worth to discuss this with an expert and to see if it's possible, if your hospital or your elderly home or your facility is fit for a robot, because there's a lot of things that are possible. And sometimes there is some points we have to look at it. So you need somebody to look at your building, look at your facility, and make a plan together. And I'm hoping that
Maxim, you are on mute, sorry.
We'll start a nice video where we will show you the robots in real life to make this more a little bit dynamic. Can you start a video for me, Maxim? Maxim, you are muted. Maxim, you are muted. Okay. Okay, what we are looking at right here is a hospital, and you see a scrubber 50 that is driving over the floor, cleaning the floor while you edit. Actually, you see two here, so it's very funny. But you can use, of course, one or two or more robots if it's a very large hospital, instead of using a big robot like this one, which is also a possibility. And you see here also, you can use and pick your own avatar, make it more look funny. For example, in the children's hospital, you can make any funny animal inside of the robot. What you see here is how the robot goes to his charging station. We also provide stations with water supply and drainage of wastewater, but this one is just for charging. But the robot goes back to it by itself. And what you see here is a robot that's approaching an automated door. And as you will see, the door will open automatically to let the robot pass, and the robot can continue his way. A traditionally normally closed door with the hand bar, of course, is a little bit difficult for robots. Here you see the robot on this dust mopping mode. So the robot is now, without any noise, without any sound, cleaning the floor. Of course, you have to switch every 1,000 square meters. You have to switch this dust mop and to take it off, but still, and you are still saving about 90% of the normally time you spend on dust mopping. But this is also a thing that comes very in handy if you have the robot scrubbing your facility. Why not also having doing the dry and very silent dust mopping? Because you can. You're keeping the facility clean during the daytime without any disturbance or making any noise that would avoid. Okay. And
thank you very much, Peter. I hope you can hear me now.
Yes, I can hear you.
Yes.
That's great. And I just wanted to mention that once again, thank you, Hector. Thank you, Peter, for all this valuable information on how we can apply autonomous cleaning in healthcare industry. Soon we are moving to our Q&A section. So I would like to announce for everyone who's got any questions regarding our today's topics, please put them in the chat box in our Teams app, and we will read your questions and our experts will answer them. And by the way, we already got the first question, and it comes from Felipe. And the question sounds as, hello, do the robots log the work done?
You want to answer?
Yes, I'll be more than happy to. Thank you. Well, the system
so I
works.
think, Peter, you can start with that one.
Oh, sorry, because I didn't really understand. Do the robot love their job? Is this what you said? Sorry.
Log the work it's done.
I'm sorry, cannot understand cannot understand the question.
Do the robots log the work it has done?
Oh, yes, of course, log. Oh, sorry, yes, now we understand. Okay, the word log. Yes, of course it does. After every task the robot is doing, actually also during real-time operation, you can follow what the robot is doing. by data that it's sending to you, to your app. Of course, we can, it's very safe, so that you only get the app to those people that are really allowed and authorized to see the app. But after the task is done by the robot, it logs, of course, all the technical information on the log files inside the robot, and it will give you a very comprehensive and very easy to read and understand report of what it has cleaned. You can see even how much time it was running, how much square meter it cleaned, how much percentage of the map it was cleaning, how much water was used, how much energy was used. So we have a lot of information. So everything you really want to know or should need to know, you can read from this reports. I hope this answers the question.
Thank you very much, Peter. I think it does answer the question. The next question is rather funny. It's asking to share the cost sheet, and for sure we can share that one, but somewhere later on directly with the customer who is asking about this question. So we will reach out to you after the webinar via email, and we will discuss this question. Oh, meanwhile, we got a question from Richard. And Richard is asking, does the X1 offer secure delivery option, closed container? Also, how do you handle network requirements for hospitals?
I can cover that one.
Okay.
If you, we did show the cover on the actual slide, which shows an enclosed case for the X1. And then in reference to networking requirements within a facility, the unit has two options. There is a SIM card for cellular service, or it can run through the Wi-Fi. So again, if the IT team supports it and works through it, it can run through your facility's Wi-Fi, or it does have an option of SIM cards. The challenge is if some of the older, larger facilities with the great basements, depending on how your cellular service, that might impact it, but in the normal operating areas, it should not be a problem. The recommendation would be the Wi-Fi, and that's how the system does receive its updates. Some of the troubleshooting can be done remotely, and again, it's always attached to the system, which allows us to maintain it. And again, if there is troubleshooting, we have, by calling us, the techs can access, in whether it's framework or something has to be adjusted in the software, it could be done.
Thank you, Hector. And actually, Richard followed with another question. He's asking, where is the data hosted? I think that still refers to this question about X1.
Yes, I can answer this one. So we have several servers, and they're all, applied with the GDPR regulations, of course, internationally. So not only with the European rules, but also with the rules that are now applied in the US. And beside that, we had a company called TÜV. It's a German institute that's independent, testing our robots against, hackers that may try to invade our robots and data. So it's very secure, it's very safe, and we have several locations of the service inside Europe and outside Europe to be sure that your data is very safe with us, and we only share it with the people that are allowed and authorized to see it.
Thank you very much, Peter. Now I have a question from my side. Is the day when robots completely replace humans coming anytime soon?
Well, sorry. Well, I love to answer this one, because this is some questions we heard sometime, of course. And sorry for a little bit, smiling. But of course, this will never be the case. It is also never to be intended that robots will take the place of humans. I always make a very simple, comparison. When you look at a carpenter and you give him an electrical saw, this carpenter cannot make only 1 or 2 doors a day, but can produce 3 or 4 doors a day. But he is still the professional carpenter with the skills that you need to make a very nice wooden door. So it's the same with a cleaner or a healthcare cleaner. You are not getting less of a cleaner. No, we don't. We still need people to operate a robot. We still need people that know and have the experience how to clean the facility and what's needed and when and where it's needed. So robots, please see them only as a super tool that makes you much more efficient and much more productive, and to help you. And again, like the resume I did on the last page of the webinar, to help the lack of people, to reduce the labor costs, and to make it for everybody a little bit more doable to continue with this, with a safe and secure and economic, competitive healthcare industry.
Oh, all right. Thank you very much, Peter. We've got one more question. Here it goes. Hello from Athens. Any certifications asked from hospitals? As many hospitals have different levels of internal procedures and committees for anything coming inside.
Shall I take it?
I could
Do it, okay.
Certifications, that might be an overseas question, so that might be better off for Peter, I believe.
I have to give an answer that's a little bit, how you say this, a cowardly answer, because I explain you why. Because there are so many regulations and so many rules, especially if I'm living in Europe. We have a lot of countries in Europe, and every country has its own set of rules and its own set of regulations. So it's very hard to give a general answer. So for this, I would give the answer, please let us know where your facility is located, and we get in touch with you. So we help you to see if your regulations in your specific country, like I think I heard Athens, so it's Greece. So we can look at it and see if it's appropriate, yes or no, to have the robot running in your facilities. And if it's not, of course, we will try to help you and support you to make it work. Because that's, of course, what we have in mind, to reach as many as people as we can possibly reach, to help, in this time of lack of people and cost reduction, and make everybody more productive and efficient without, more stress. So I guess when there is a regulation, we will try to live up to it. And if it's not yet, then we will do our best to meet up with it. So please let us know.
All right, let's see. Let's check if we have some more questions in our chat box. Here we go. Which machine would you recommend to use to clean the floor of a private clinic?
I could take that one. Again, a lot of it, that's why we always recommend that you reach out to us, and we'll try our best to get one of our representatives out there to best help survey the facility for you. Again, the unit that's on the screen now, if it is a clinic or professional office space, would be ideal. It is a hybrid unit, and what I mean by that, it has both capabilities of being a scrubber and a vacuum sweeper. So depending on which bladder or pieces inside the machine, it'll identify what the task would be. So if you would put the wet bladder in, it would be an auto scrubber. If it's the vacuum bags, it would do the vacuum sweeping technology. That would be ideal for those smaller areas. And again, it's ideal because it does help increase the hate to use the word perception, but I was with someone last week, and ideally, they were getting a lot of complaints about the areas not being clean because they didn't see anyone. And this would give them an opportunity where people would visually see something on the floor, helping them keep the facilities clean, at the same time, helping that perception at the facility.
Thank you very much, Hector, for your answer. And we got one more question from Philippa. How large is the area that is typically cleaned with Fantas? So maybe Peter can answer that one.
Yeah, I'd love to answer this one, because this is a very nice one. Because I remember the introduction of the Fantas in May last year, when we won the Innovation Award there on a trade show in Amsterdam. And I actually never thought that a Fantas would really be comes in handy with a big hospital, because hospitals, of course, are big facilities. They are big buildings. But of course, and this is, of course, to our knowledge, I knew that this was possible, but I never thought about it. But when we talk about cross-contamination, most people know that a hospital never has only 1 or 2 big machines that cover a whole of the hospital. No, most of the time they have smaller scrubber dryers that only clean in one section. So you can have a hospital with let's say 10 or 20 fantasies, or let's say 5 or 6 scrubber 50, depending on the size of your hospital, and perhaps a big robot inside the public areas. But to come back to the core of your question, a Fantas is suitable for about 1,000 to 1,500 square meters a day. I guess that Hector can fill me in on the square feet there. Hector, save me. How much is 1,500 square meter? I guess it's something like 16,000 square feet. Am I right?
I couldn't give you the exact number today. I'm still a footage guy. I'm working on the conversion. As you know, us US guys are very dedicated to our square feet and don't want to give it up to the metrics.
I understand, but I'm very sure it's very close to 16,000 square feet a day. Okay, so of course you can have it run twice a day or 3 times a day, but it's a compact machine. So it has also other advantages that can also go under tables and under desks because it's so very low. It's actually the most compact professional sized robot with all the abilities of a big robot that we made in a very compact size. So it's about the situation. So best is to invite somebody, an expert on this, and to look together which robot would be the best suitable for your case specifically. Yeah.
Thank you, Peter, for answering this question. I think we have 5, maybe 10 more minutes to answer the questions. So please, if anyone has some more questions, put them in the chat box. Meanwhile, we're gonna post there a link to our website where you can learn more about our products. And we're also gonna put the link to the contact form that you can follow, and there you can submit an application and one of our specialists will reach out to you very soon. So now let's check if we have some more questions so far. Oh, yes, we have one. So it comes from Philippa. Is it possible to get the slides? I think I know the answer to this question myself. First, I thought it refers to a part of a robot. Maybe some of our robots are also equipped with slides. Of course, we will share the PPT with all the participants of this webinar in a few days after this webinar. And we also send you the link to the video for this webinar, so you can go there and check our webinar or the slides. Depends whatever you need.
And I can add to that we also have a very nice white paper on the subject as well, which gives you a lot of information.
Let's see if we have any more questions.
Raising his hand. Okay.
Good evening to everyone. I hope you hear me.
Yes, I can hear you.
Super, guys. Shortly, I can give you all some conclusions because I'm a business developer with many brands. My name is Anatoly. So let me share with you. So what we see presently, especially for the healthcare, no subjective elements. This is about robotics cleaning because healthcare is related mostly with regulations and emotions, and that's a good news for all of us in case to exploit this situation for better, for good, and more effective. Then next improvement is related with task, not will, because people are more, and especially staff is becoming more, let's say, subjective, but we are in objective world and it's becoming more objective and less subjective. So this is also one good, let's say, argument to go ahead on the robotics into the healthcare. Next, maybe...
I'm sorry to interrupt you. but we have just few minutes left. Can you
I'm not-
complete
just-
your speech just in 30 more seconds? We will appreciate it.
Just the problem is that in Southeast Europe, for example, also in Athens, Greece, Macedonia, and so on, we have to explain to the staff, maybe to explain to existing staff, how this will improve their work life and their work results. And maybe our efforts have to be also related with existing staff. And thank you very much. And that's it. Thanks.
Okay.
Really.
Thank you very much. And of course, we always have to manage expectations. This is my golden rule. So I would never talk about robotics and all the technical aspects. First, I will try to explain what it can do for people, because people are the ones that controlling the robots, not robots that controlling robots. This is, fantasy from science fiction. So actually, the robot is just a super tool to help people. So sorry. Okay. You have a last question there, Maxim?
Let me check. Do we have any more questions? No, I think that was all. Thank you, everyone, for sharing your questions. Thanks, everyone, for joining our webinar today. As we mentioned, we put the links in our chat box. Please check them there, and we will share with you all of our materials considering this webinar in a few days.
Okay, thank you very much, everybody, for taking the time. I saw a last question coming, so please, if you have any questions, put them on our website or give them on the comments, and we will come back to you anytime, Maxim. So we can always answer questions later as well after the webinar, of course. We're always there to answer your question.
Thank you, everyone, for taking time today, for joining us. Again, looking forward to following up with everyone. If there's any questions that were missed, we will make it a point to reach out to everyone and make sure you get the information you need. And look forward to seeing you all in the future.
Okay. Bye-bye, everybody. Okay.
Good day.
Thanks, everyone. See you soon.